Hi, my name is Debra Benson. I'm 64 years old. My husband and I live most of the year in Mexico home that is about an hour's drive south of Cancun on the Yucatan, the Caribbean side of the Yucatan. I wanted to tell you today about my journey, which has been a long journey of about 25 years of pain management, 2 spine surgeries, a cervical disc surgery, and a lumbar surgery. In this past 25 years of pain management, I had degenerative scoliosis. It was rotating. The first surgery I had was in 2008, which was the cervical disc surgery. I had C4, 5, 6, and 7. And at the time, I thought that was great. It took a little bit of recovery time, but then I didn't have pain after that. Prior to that, I had been through pain management, different medications, many injections, and all of those worked for a short time, but then the symptoms all came back. So the surgery in 2008 was my first, May of 2008. Then some period of years I didn't have the neck problems, but my neck has always been stiff, even after the surgery, stiff, painful. Wake up in the morning and have to roll my head in different directions to just loosen it up a little bit, and that gradually got worse. So in January of 2009, I had an extensive lumbar fusion. I had T11 through S1 fused. I was in intensive care for a week. It was a 9-hour surgery. It was very drastic. So that was about a 2.5-year recovery of continued pain management and medications, which were hydrocodone, nerve pain, Flexeril, which was the best muscle relaxer that I had. That's the route most of us take. We go the medical route because that's what we think we're supposed to do. After about 2.5 years of recovery, I just realized I still have pain, even after all of that fusion. So I was still having the pain, but it could be controlled with medication, but who wants to be on that kind of medication for long term? So I was on it 15 years. Then in November of this past year, I started having excruciating pain in my neck, back of my head, temples, and I was in Mexico at the time. I worked with the specialist there, had physical therapy treatments, but the pain just kept getting worse. None of the medication was working anymore, and so the orthopedic surgeon said the only way you're going to get out of pain is to extend your fusion. So number 3 is now herniated and wanted me to extend the surgery to include 3 through 7. I said, I don't think so. And so I came back to the States, followed the medical route. I saw the neurosurgeon, CT scans, MRIs, then I was referred to pain management, and you guessed it, more drugs. They recommended a facet injection. I had the facet injection, and it was excruciating for me. I know everybody's different, but it made it worse. I had a huge headache, which I didn't have prior to the injection. I waited out the 2 weeks that they said it might take. I got no relief. Medication not working. Injection was making it worse. They recommended a second facet injection, and I just said, no, I'm not doing that again. That hurts too much, and it's not helping. So then I was referred back to the neurosurgeon to have another fusion. And I just pushed back. I said, there has got to be something else. Well, my dear brother had been telling me for over a year about the results he had had with Dr. Winter. But being the stubborn traditionalist that I was, I said, well, I'm going to go the full route on the medical, and, you know, surely something will work. Well, it didn't. So after all of the appointments, I had come from Mexico to be here for 2 weeks to get the appointments with all the surgeons and specialists. And I extended my stay twice because I started getting really good results through Dr. Winter. I met with Jean also, Jean Winter, and she recommended some nutritional supplements along with his treatments. At this point that my posture has completely changed. I'm no longer tilting, I'm standing straight, my neck is not jutted out now like it used to be, and I feel so much better with the posture changes. I came in today to talk to you about my experience, and I am happy to say I don't have any of the pains, no burning pain, no neck pain, no head pain, no headache. I had been complaining for this past week that we worked on, my tailbone was really painful. So I don't have the tailbone pain today, and I put the little happy face on my chart because I feel so great. The whole body approach, I would say please don't be afraid to step out of the box, because I had never done anything like that before, and I feel great. I had a follow-up MRI, and one of the radiologists said he didn't see a herniation anymore in number 3. And then my neurosurgeon, when I went back yesterday to check with him, he said you still have a mild herniation, but most people walk around with that and they never even have symptoms. So he said I would never do a surgery on the level that you're at now. And if you're not complaining about any of the other pain and burning and cramping and sore muscles and spasms, then I would say you're good to go. So thanks for listening. I hope there was something there that would make you call, and the front office people are super friendly and they can help you make an appointment as soon as possible.
So do you really need surgery? Maybe not. Call Dr. Winter at 770-536-6600.